Hi, thanks for tuning into Spinal Attraction. First thing is that I don't diagnose or prescribe. You may want to consult with your healthcare professional. Let's talk about ice and heat and when to use these things because there seems to be some confusion. As a professional massage therapist for over 35 years, as well as karate, kickboxing, training, teaching, all that. Yeah, we got banged up a bit. We had some sprains, dislocations. We had to handle a lot of times. Ice was our best friend, usually. One time, early on, when I learned these things like about ice, I decided to really test it out on myself. I had a sprained ankle, and I went home and I filled the bathtub with nice hot water. I like it real hot. And I got in and soaked as usual. As I laid there for a while, my ankles started to throb. Basically, every heartbeat, I could feel it throbbing in my ankle. And then I got out, and basically, it made it swell up more, what's called a vasodilation. The blood vessels are dilated and soft, and all the soft tissue lets more swelling in. And then when that cools down, it makes it real tight and it hurts a lot more, slows down the circulation of the natural process and all that. So there's something that we learned called RICE, which is rest, ice, compression, and elevation. RICE. So what that means is we're not using rice, we're not making a pot of rice. No, rest. We all know what that means. If you say your back is really bothering you, you lay on the floor or a firm surface, and you can put your knees up and your feet resting on a bed or a chair, and you can put your ice underneath your back, which I'm going to show you a demonstration more clearly in just a minute. Compression, you can this would be more of a apply to like your knee, for instance. You would wrap it with something, an elastic bandage, like an ACE bandage, snug, not too tight, but snug, helps to push the fluid out. And of course, you need to pay attention. You're not cutting off circulation. Loosen it up or take it off periodically, and then snug it back up again. That can really be helpful. And elevation, again, if you're laying with your feet and your legs up, resting on something, the blood, we're using gravity to drain it back into the body. Some of my clients, quite a few times, told me that a healthcare professional told them, just put heat, like on their back. I worked on backs and necks mostly. Yeah, go home, put heat on it. And if it's a newer injury, especially within 48 hours, don't use heat. You're again opening it up to vasodilation, to cool down, and it'll feel real good until it cools down. It can get a lot worse that way. Cold is like an anti-inflammatory or ice, and then the heat opens it up so it'll flow, but then I like to end with ice or cold again to make sure that you've constricted and pushed out the inflammation. Let me do a slight demonstration here for you. What I like to do is just a simple pillowcase. And you can use a bag of ice, or if you have one of these cold packs, you simply slip it into the bottom right there. It's right here. And all you have to do, nothing fancy, just make it so that all the cold is right there, and you're going to put it on there, on your knee, whatever it would be. And I have representation of this cold pack or a bag of ice, and you're going to take that and put it right about there for most of us. It could be anywhere in your back, but there it is, your cold pack. And as it is penetrating into the soft tissue, the muscles and all, as well as the nerve roots. And if you're not familiar with that, the nerves that come all the way down your spine exit in between all the sets of vertebrae, and especially, I'm sure you've heard of sciatica, come out of here and go right through your hip and down your leg. And with the cold pack, that actually makes more space for the nerve compression. That's what's really helpful about it. So there you have that. And actually, I wrote this book called The Back Bible. We'll have a link at the bottom here. You can get this. It's currently on Amazon. And on page 44 is a story of what I just told you about how and when to use ice and heat. So thank you for watching. Like, subscribe, and let's share it with as many people as possible. Stay curious. Thank you.